And we're back talking about healthcare here in Canada and the many, many problems that our nation is facing. Dr. Shawn Whatley is my guest. He's written multiple books on the topic, and he's promised that he's got all the answers here today. So no pressure, Dr. Whatley. I want to really pick your brain on this issue and start off with sort of the ground level. Angus Reid had some research that came out last year that suggested we've got a shortage of 6 million family doctors in this country. If you're the all-powerful health minister, what types of changes do you think need to happen in order to reduce that number so that more Canadians actually have access to a family doctor?
Yeah, great question. So I usually push back on the question and say we actually don't have an absolute lack of family docs. We have a relative lack of family docs. So today, a family doc in quote unquote full-time practice would carry a patient load of around 1,250, maybe even 1,500 patients. Certainly, if you have 1,100 patients, you're working really hard and doing a good job. Whereas even 10, 15 years ago, it was very common for a family doc to carry 2,500 patients or 2,000 anyways. Some docs in the community had 3,000, 3,500. I know of one doc who has a patient roster over 5,000 patients. Now, he has a number of other staff that help him out, but they're all rostered to this one particular doctor. So the reason family docs aren't able to care for as many patients is our administrative burden has gone through the roof. We're well over a 1-to-1 ratio, 1 hour of face time to 1 hour of administrative time. But also, what you're seeing is many family docs are going through what I'm calling is a quiet retreat, going into part-time practice or semi-retirement or a focus practice or doing locums. And we can unpack why that's happening, but I would push back a bit on saying we actually just need more bodies. I would say we actually need a little bit more freedom to allow family docs to innovate and find out what their patients actually need without feeling like they're restricted by a whole bunch of regulations and not being able to use creative thinking.
That's really interesting. I don't often hear that point. So if family doctors, let's say they didn't have as much of an administrative burden, and if there was some more flexibility to, operate their practice the way they want to, does that mean that the shortage we hear of family doctors, does that largely evaporate, or could it evaporate?
Oh, absolutely. I'm convinced that it's not an issue of a lack of bodies. So, for example, much of the work that the family docs are doing right now could be done by a well-trained clerical person, but the government doesn't fund you for that. So, at $36 for a visit, I don't have enough finances to be able to pay someone else to do that work. The other issue is that if you do have a very large practice. I'm thinking of one particular doc where the other physician in the community passed away. He's basically the only person in that area for a short time. So he ended up with well over 5,000 patients. However, he hired 2 nurse practitioners and a number of nurses to help him. And he was giving great care, short wait times, high quality, great patient satisfaction surveys. But he worried. He said, "Listen, Shawn, I'm worried because I'm standing way above everybody else in the community, and right, the tallest dandelion gets cut when the lawnmower comes by." And so there are a number of structural issues that we're looking at where people don't want to stand out, and they have this administrative burden, and the government doesn't want to admit that it actually costs money to manage a practice. So again, huge question, and I hope I've unpacked it a tiny bit.
No, that's fascinating because, like I say, we don't often hear that point. I want to ask you, and this is a big question, we'll break it up, but addressing the long surgical waits that we face in this country, just maybe with 20 seconds if you want to start off on how we get those long waiting times down, and we'll pick it up after the break.
Biggest issue is OR capacity. We have the surgeons, they want to operate. Many of them have been cut down to 1 day a week. They used to be able to operate 2.5 to 3 days a week. We have unemployed surgeons in Canada. So it's an issue of not having enough OR time, full stop.
Okay, well, in a way, that's also some good news that we have the surgeons. We just need to manage our resources in a more effective way. When we come back, we're going to continue to talk with Dr. Shawn Whatley about how we start to get our healthcare system improving and on the right track.